Hello. So for the Genomics showcase, my genetic disorder that I chose to focus on is breast cancer. So, what is breast cancer? It is, like other cancers, it's a disease where the cells in the breast tissue specifically, they grow out of control and they form tumors. This can originate in different areas of the breast. It can originate like in the milk ducts or more in the actual breast tissue in any part of the breast. And depending on where it originates, can also dictate what type of breast cancer it is or what kind of tumor is growing in the breast tissue. Um, with breast cancer, the risk for tumor spreading to other parts of the body is also pretty high if it goes untreated. It is classified as non invasive if the tumor is localized just to the breast tissue and doesn't spread, versus invasive when it does spread to other parts of the body. And then breast tumors are actually very hormone receptive, which causes further growth. So they're pretty receptive to like estrogen and progesterone, and increased levels of those hormones can increase the rate of growth and the rate of spreading for those tumors. And then the way that genetics actually plays a role in this condition is there are risk factors like lifestyle and environment, obviously, but genetic factors do play a role in that development. And there are genetic mutations that can predispose individuals to have a higher risk of developing breast cancer. So, genetic testing for this would be the most common test is for the BRCA1 or 2 gene mutation. It's the most common screening, and this mutation is related to breast cancer, so it predisposes individuals to have a higher risk of developing breast cancer in their lifetime. It not only increases breast cancer, but also ovarian cancer. It can also increase the risk of developing other cancers such as skin cancer and pancreatic, but those are less common. The most common are those breast and ovarian cancers. It follows the autosomal dominant pattern of inheritance, so you only need one copy of that gene mutation for it to be passed on. And then the most common way that this sample or test is collected is just through a saliva sample. It can also be done through like a cheek swab or a blood test, but the saliva sample is most common and it's super easy. You can do it through like a genetic counseling or a health clinic, and they send that in and then get results in the next few weeks. Um, and then the BRCA1, 2, or 2 gene mutation, it's the most commonly tested because it has the highest influence. Not only is it the most common, but it also has the highest penetrance for those breast cancer genes. So it's really good for people to know if they're getting tested for breast cancer if they have this gene mutation, because it has the most influence on the risk for developing breast cancer throughout your life. So, the plan of care for a patient with a BRCA1 or 2 gene mutation, some nursing interventions that are really important would be to definitely encourage further genetic testing and genetic counseling for these patients. Also, to encourage further surveillance in the futures, like surveillance strategies like MRI, mammographies, or mammograms. It'd be really good to especially encourage these patients to get them more frequently as they have that higher risk of developing breast cancer. And then just discussing future treatment options for them, like those surveillance strategies, but even, the possibility of what could entail for management of breast cancer, like surgery or radiation, things like that. It would also be good to talk to them about management. So, again, with that frequent imaging and screening, like the MRI and mammograms, it would also be good to possibly do ultrasounds for screening of ovarian cancers as well, just to make sure they're covering all their bases. And then, like I said before, surgical and radiological considerations, and even talking to them about the possibility of prophylactic surgery. So, having a prophylactic breast cancer surgery, just so they can reduce that risk of developing that breast cancer and just kind of nip that in the bud. Also, it would be great to talk to them about health promotions, so lifestyle modifications to promote that healthy body, having regular exercise, a nutrient rich diet, and especially alcohol and smoking cessation. Just health promotion in general will help decrease that risk of developing breast cancer. And then just education in general about the BRCA mutation and risk of other cancers. It's also really great to talk to them about the increased risk of cancer for their relatives, as those who have breast cancer increase the risk of their blood relatives also developing breast cancer. So the possibility of their relatives also getting genetic testing would be important. And then risk reduction strategies, like we've talked about before, the frequent surveillance strategies, health promotion, and then even especially emotional and psychological support, as this can be a really scary thing to go through and discover that you have this mutation, because that is a increased risk of a scary disease. So just providing that emotional support, that psychological support, and even as they go through the cancer process in the future, things like support for body image and especially emotional support for their family as well. Some really great resources for these patients. The American Cancer Society is a really great resource. They work closely with a lot of medical institutions, and they have a lot of peer-reviewed information. They have a really great website that has tons of articles, not just about breast cancer, but just about cancer in general. They also have a lot of education on genetic testing and the benefits of those. And then there's also breastcancer.org, which is a really, really great resource. It's more specifically focused on breast cancer. And I love it because it has a patient-centered approach on breast cancer information and education, so it's a lot easier for them to understand. And it gives all kinds of information just about the disease, about treatment strategies, and how that all works. And then it also does give information about genetic resources and testing as well. And then the advocacy poster, I apologize, it was very tall, so I had to cut it in half. So on the left side is the top half of it, and then the right side is the bottom half. But it just talks about breast cancer awareness and facts that people should know about so that they can be aware of that and kind of monitor that in themselves. It's really interesting. About 1 in 8 women, or just people in general, will actually develop breast cancer at some point during their lifetime. Some really cool statistics. About 32% of all cancer diagnoses, or new ones, are actually breast cancer. So that's a pretty high percentage. About 16% of women with breast cancer are under 50 years old. So it's more common in older women, but there are still that 16% that are under 50 years old when they are first diagnosed. And then about 15% of women with breast cancer also have a family member who was diagnosed previously. So, like I was talking about earlier, the blood relatives really increase that chance of developing breast cancer at some point in your life. And then some other statistics: about 5 to 10% of breast cancer diagnoses are genetically linked. So a lot of that would be that BRCA1 or 2 gene mutation, among other mutations, but that is the most common. And then some support and resources. There are plenty of support groups, and there's lots of counseling available. Breastcancer.org is listed, and then some signs and symptoms down at the bottom. And then here are my resources. Thank you.